our first speaker today is John Hillson, presenting Defining the Nursing Workforce in Radiation Oncology, Demographic Results of a National Survey.
All right. Yep. Okay. Thank you so much. The Oncology Nursing Certification Corporation oversees oncology nursing education in the country. And how does it actually do anything? Am I hitting the wrong button here? No, I've been too many times. Those are my disclosures. And the first actual education assessment of radiation oncology nurses was only done a couple years ago, and one of the authors is here today. Thank you for that. 3 large academic medical centers, they found nurses didn't receive any training on this subject in school. It was only about half of them that received any onboarding in the subject. And a minority of the nurses were completing RO-specific training from national organizations. Astro used to cover some nursing training, and they don't anymore. The nurses' confidence was moderate, but for all that, they were 100% responsible for coordination of care and patient education. And I was interested in going and compare that to some of the national trends. This data collection was back in 2018. The average age was pretty close. Radiation oncology nurses may be at slightly higher than the national education. And high levels of experience in both groups, but the actual level of experience in radiation oncology itself was lower. For all that, it was 3% at the time only were involved with this study, had less than a year of experience in radiation oncology. In a more recent study, they were going and trialing a pilot, and it was over half of the nurses involved in that study had less than 1 year of experience in radiation oncology. And that's been part of the national trend. We're still the largest group. There's over 4 million nurses in the country. But during COVID, we have an estimated loss of at least 200,000 senior nurses. That means the average age has gone and dropped very quickly. The average amount of experience has dropped pretty rapidly. The average education has gone up, but again, this isn't a subject we're trained on. And higher numbers of nurses that were trained remotely. We have 1 in 4 that are planning to retire or leave the profession within the next 5 years. So a lot of these disparities are going to get a little bit worse in a hurry. Nationally, only 1.7% of nurses were certified in oncology. Again, that was general oncology. Most of them critical care, understandable during the pandemic. So new graduate nurses, there are estimates that the actual oncology lecture portion is maybe 4 to 5 hours over the course of a 4-year degree. New nurses typically need about a year to be comfortable in their work setting. We have a problem that about 1 in 4 end up going and leaving their job in the first year. Feeling prepared, feeling competent in the workplace, feeling you're part of the work culture. That goes a long way to making sure we don't have the staff turnover. Commission on Cancer has gone and required 36 continuing education credits every 3 years. That's for non-certified nurses. There's only about 10 credits that I'm aware of in radiation oncology that are available right now. So we don't have the training there. For all that, APP utilization is up. We don't have the training there either. Survivorship is going to become a huge part, and it's a huge part of my own job. Multimodality care, radiopharmaceuticals, somebody needs to be involved in actually doing the infusion and managing the adverse events. There is no credential or certification in radiation oncology nationally. So Oncology Nursing Society and the Certification Corporation, they were looking at a role delineation study. How do we identify the knowledge and skills needed for competent practice? That's a little bit of a trick to do when you don't have standard education in the physician side as well. And they wanted to look at informing future education initiatives. So when we get nationally, this was a group of radiation oncology nurses who were interviewed by online surveys. Education level is slightly higher. I wish they'd broken down the years of experience. They didn't. Hopefully when they do their final publication, they will. You can see the number that are certified in general oncology that focuses heavily on medical oncology versus the numbers that were trained in radiation oncology. Huge difference. Also for the certified nurses,
That's
other was not oncology or hospice and palliative care. That's somebody who's come to radiation oncology after spending years in the ICU or cardiology or something that might not be relevant to the field. So new to oncology. In 49 states responded. Over half the responses came from 8 states and most of them on the Eastern Seaboard. So when it comes time to going and getting into some states, you might have a difficulty finding experienced nursing personnel. Not surprising, most of them worked outpatient, most of them involved in patient care. And in terms of the workplace, again, not so surprising that the academic medical centers versus community, larger centers versus smaller facilities, and urban versus rural. Again, if you're in a rural practice, you're probably going to have more difficulty finding a nurse who's actually got experience in this field. So in conclusion, a minority have RO-specific training. There's a significant portion that are new to radiation oncology. They're also probably new to oncology. And we're seeing some disparities in academic versus community, urban, rural, and some geographic disparities. And so what's the value here? Optimizing the multidisciplinary staff has been called the most impactful strategy to reduce radiation oncologist burnout. This actually directly affects the physicians. The SHIELD protocol, patients were being seen a second time a week by a group of EPs and nurses predominantly. We were able to go and reduce the cost of care, reduce the admissions to the emergency room and the hospital admissions that was going on at Duke. This other study was just recently presented at ONS Congress. There is no national guideline for moderate sedation during brachytherapy or during radiation therapy in general. Former critical care nurse at UCLA, she now goes and runs the brachytherapy department. They started doing some screening of patients beforehand, greatly increased the safety, greatly reduced the cancellations. And some of the data that I'm liking is coming out of ERAS or out of the surgical areas, dividing up the roles by what actually requires a radiation oncologist to do and what doesn't. That gives you more time to go and do the job you want to do, but also make sure that some of these other duties are being understood, that they're being followed through, that they're being examined. One of them, I should say, Commission on Cancer wanted 42 days to postoperative radiation therapy for head and neck cancer. We've made a lot of substantial growth in that area by just having the nurse practitioner in radiation oncology actually talking to the PA in the inpatient ENT area. It wasn't something that really required a direct physician input. And my references. And thank you.